What's going on, everyone? Happy Wednesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for a Wednesday morning discussion for Wednesday, February 21st, 2024. If you're new to my channel, welcome to my channel. This is where we do the daily pandemic update, and we also do other videos at times, such as this one, where we just do general discussions about what is going on with the viruses right now. If you want to stay in the know with COVID, influenza, RSV, or any of these viruses that are a health threat to you, subscribe to my channel down below. Give this a thumbs up and help other people become more aware of what's going on by sharing my channel and videos. Alrighty, folks. Today, I thought we would do a brief discussion this morning. This will probably be generally between 6 to 9 minutes, somewhere around there. But I'm seeing some things go on right now that I am just not happy about, and you shouldn't be happy about as well. First off, let's just start off with illness in general. There's a lot of people sick right now. Yes, we're down from the winter peak of COVID back around the holidays. It dropped, but now it's not dropping all that much. And BioBot actually rose a bit yesterday, though probably overdone on BioBot, as the CDC did not have as big of a rise. Hey, a slowing in the drop of the national levels for COVID, it's not a good thing. And it means that things are remaining elevated. But there's also a lot of other illness still going around, and when you take a look at the CDC data, you do see some states are actually rising again for COVID. Some states are actually rising again for influenza as well. And the signs are there. There's a lot of indicators that are popping up, or at least that I am seeing. Locally, I'm seeing more sick calls on CAD. I'm seeing more respiratory difficulty calls. I'm seeing on social media, such as Facebook. I was on Facebook last night. I saw a ton of postings of people saying they're sick, or they've tested positive for COVID. Then you read the comments, and you see people say, oh, I know a lot of friends that have COVID right now. Yeah, it feels like all of a sudden it's gone back to early January when it comes to all these indicators. But then there's another indicator that's really a big problem, locally here anyhow, maybe in your area as well. Do you have public transportation? Chances are they have service notifications of what's going on social media. We have the Southeastern Pennsylvania Transportation Authority, otherwise known as SEPTA here in the Philadelphia metro area. And they tweet their service disruptions on Twitter. Well, the last couple days, starting on Monday, but it really became noticeable this morning, and I actually did a tweet about this morning. They're having a lot of operator shortages right now. Bus routes, trolley routes, train routes, you name it. They're having a ton of operator shortages. Now, they're not saying if that's because of people calling out sick, but it seems really strange that every time illness starts to go up again, that happens. And you know what I'm noticing? A lot of the transportation workers are not masking. And you know, some of these modes of transit, you know, they get pretty crowded. Like SEPTA, for example, they're not back to pre-COVID levels of service because, well, number one, their ridership is not back, but they're also not back to pre-COVID levels, and at rush hour sometimes overcrowding happens. What happens with overcrowding? Well, we know when you're in crowded situations, your risk of getting infected does go up significantly. I'm seeing something else now that is really disturbing to me, especially on Twitter, I still call it Twitter. I'm seeing a hostile environment, a very, people, if you try and say, ooh, there's a lot of people sick right now, and levels are still high. You're seeing a lot of people saying, oh, that can't be. We peaked. Nationally, we peaked. It's dropping now. You're wrong. You can't be right. You need to stop scaring people. Well, no. Let's face it. There's a lot of people sick right now. When I'm out and about, all of a sudden, within the last week to 2 weeks, it's like, hello, light switch. It's back to what it was in the wintertime in terms of the amount of people that I hear coughing. And when I say back to me, what it was in wintertime, I mean back around the holidays, at the peak of this winter surge. So there is definitely a rise going on in some places. We talked yesterday a little bit about national trend, and I've said this several times before, and I'm going to say it again now. Please, if you're trying to do a risk assessment for maybe a doctor's appointment or an event in your local area, please do not use the national trend to do that. Just don't. Look and see what is going on in your local community. If your area is reporting a wastewater site, if it's up to date and reporting, check that to see what the levels are in your area. We have a website. Well, not my website, but there's a website out there called Wastewater Scan. They check for multiple different viruses. If you have a wastewater site near you on their map, check that. See what's going on in your community. Don't go basing off, well, they're saying the national trend's dropping right now and we've peaked for the winter wave. Okay, on a national level, yes, we've peaked from the highest level that we were back at the holidays. But there's some areas, I'll give you a great example, York, Maine. York, Maine for COVID. They're not following national trend whatsoever. York, Maine is really starting to pick up the pace right now. Chicago, going up. Phoenix, Arizona, going up. I also noted on Twitter this morning that in San Francisco, they're having a little bit of a mini rise again for COVID. Pay attention to what's going on in your community, because what is going on in your community ultimately affects your chances of getting infected. Going off and looking at, well, nationally things are dropping. Okay, yeah, maybe nationally things may be dropping. But what's going on in your community means a heck of a lot more when you're trying to make a decision whether or not to go to the dentist, to have your teeth cleaned, to go to a doctor's appointment. Because how many people are infected in your local area really matters whether or not your risk of getting infected is really high or really low. And there are some places where wastewater for all the viruses right now are really dropping off nicely. If you live in one of those areas, hey, congratulations. It's safe for you. You can go out and maybe you can go out and get an appointment. It's not totally safe, but it's safer than what it is in places that are rising. And I think it's going to stay that way. I think there's always going to be local areas that go off and do their own thing. We're not going to see everything be uniform. Everything is pretty much mixed up right now, and it's something we're going to have to keep an eye on as we go forward. Local areas are going to do different things. Like, for example, back during the Delta wave. Remember Delta in 2021? Yes, you remember Delta. In the beginning of the summer, the South was really going to town. The North, not so much. New York State started going up in August of that year, but it wasn't until the fall came around that the North started going up. And that's, see what I'm talking about here? Focus on your region. Focus on your state, community, city, town, your local area. Don't focus on a national trend to try and decide, well, is it safe to do something? Because by doing that, you're going to get yourself into trouble. And what trouble am I talking about? You may risk getting infected if you listen to these people that are continuously trying to minimize this on social media by going out with bashing comments. Oh my goodness, I made a post yesterday on Twitter. I couldn't believe some of the comments. I ended up blocking some people. They're saying, you shouldn't look at it that way. They're trying to paint for every little negative that you comment that you make or tweet that you make, they turn it around into a positive. Well, overall, the national trend is going down. You can't just finger point at certain communities. Yes, I can. I finger point at certain communities because I want the people that live in those communities to know what's going on. I want them to stay safe. Okay? Got it? And this doesn't just go for COVID. This goes for all the viruses. Be in the know with what's going on. Measles. You're going to hear about this later today on a pandemic update, but I'm going to give you a little sneak preview. There was yet another measles case in Florida at that school now. Down there, Broward County, I think it was? Yeah, it's now the 6th case there. I'm really concerned. I think measles is going to develop into more outbreaks as time goes on. And especially in the state of Florida where they're not all that good about handling or controlling outbreaks. Okay? That's all I want to talk about today was just follow your local trends. Please don't get caught up in these minimizers that are out there trying to tell you, well, national trends dropping now. You shouldn't be concerned. Yawn. This happens every winter. It's winter. This virus is seasonal. That's one, real quickly. That's the other thing I'm seeing about. Well, it's wintertime. It should be rising. Oh, really? It's seasonal? Did we all forget what happened in 2022? Come on. back in 2022, spring, there was a wave. Then it dropped a little bit. Then summer, there was a wave. Then it went a little higher, dropped a little bit. Watch my hand. Then fall came, went up, dropped a little bit. And, well, winter, it went even higher. And who knows? Are we going to follow that this year? I don't know. Last year, we just continuously dropped right on through to about July. And then 4th of July, we started going up. Who knows? Will we see a spring wave this year? Don't know. There's a JN 1.4 variant over in the UK. It's worth watching. It's not rising here yet, but who knows? At any given time, things could change and start rising again. So be in the know with what's going on in your community. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. Share this with anyone you know. And of course, I will see you again this evening for our regularly scheduled pandemic update. Thanks for watching. Stay safe, everyone.